Hello, and welcome to Scholars Hub at Home. I'm Rose Lucibello, Manager of Advancement Events at York University. Thank you for joining us today for today's session titled Muscle Matters: The Importance of Muscle Health in Older Adults. Before we get started, I would like to take a moment to acknowledge the land I am on. Because we may not be gathered in the same place, the land I'm about to acknowledge might not be for the territory you are on. Please take the responsibility to acknowledge the traditional territory you are on. As a member of the York University community, I recognize that many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of York University. York University acknowledges its presence on the traditional territory of many Indigenous nations. The area known as Takaronto has been caretaken by the Anishinaabeg Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject of the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. Now, we would like to conduct a quick poll before the session begins. The question is, how would you rate your knowledge regarding the topic of today's presentation? The poll is on your screen right now, and I'll give you a moment to respond. Thank you. This helps our speakers learn more about our audience. If you need help with Zoom webinar at any time today, feel free to click on the Q&A button at the bottom of your screen and enter your question. Our team is ready to help you. That same button is used to submit questions to our guest speaker during the Q&A period. You may enter questions at any time during the presentation. Please note that all your questions and comments are visible to our panelists and staff working behind the scenes, so we ask that you please keep them relevant and respectful. Now, I'm really happy to introduce today's speaker, Assistant Professor Michael Paris. Mike completed his PhD at the University of Waterloo, where he investigated age-related adaptations in skeletal muscle health and their associations with muscle function and metabolism. He subsequently pursued postdoctoral research at Western University, focusing on the mutual interdependence of the nervous and skeletal muscle systems in the production and control of muscle force. In 2023, he joined York as an assistant professor in the School of Kinesiology and Health Science, where his research program seeks to elucidate the neuromuscular mechanisms underlying age-related declines in motor function and to develop strategies aimed at preserving muscle performance across the lifespan. Welcome, Mike. And I will be back after your presentation to join for the Q&A.
Apologies. Hi, everyone. Sorry, I'm having issues with my internet here in Bethune College. Can everyone hear me now?
Yes, we can hear you.
Okay, perfect. And my screen is shared.
Yes, we can see that too.
But I have a quite unstable connection, I'm being told, but okay, perfect. Yes, so thank you all for the invite, and thank you, Rose, for the wonderful introduction. I just want to kind of share some of our interests from our lab, which is all focused on skeletal muscle health with sort of a perspective for trying to understand how our muscle health changes throughout the aging trajectory. And so I'm going to try and keep it quite high level, and I'll be sharing some work I've done mostly from my PhD work. Because I've just started here recently in York. We haven't had time to sort of establish some of these connections, but I'll Sorry, am I back now? I'm gonna hotspot off my phone because
Yes,
my
we
internet here
see
at the
you again,
thing is
Michael.
okay. Sorry about that, everyone. So I'm not sure what I've already mentioned, but basically, I want to just kind of walk everyone through um, something that's near and dear to our lab that we're interested in, sort of muscle health across the aging trajectory. So trying to understand um, how we can begin to quantify muscle health, what it is, why I think it's so important, and then perhaps what we can do to actually perhaps maintain our skeletal muscle health. So I just always want to start off with this sort of, I like to start off with this sort of slide in which we have 4 MRI images of the mid-thigh musculature of 4 individuals. And so to orient everyone here, anything in dark gray, this is referencing skeletal muscles of the quadriceps, the hamstrings, and the adductor muscles. And anything in white would be considered adipose tissue, either subcutaneous or intramuscular adipose tissue.
Mike, I just want to let you know your slide's not on right now, just so the audience is aware.
Sorry, is that better?
Yes.
Okay, I apologize. This internet's causing a lot of issues. So just to orient everyone again, anything in dark gray here, this is considered skeletal muscle. And anything in white is referencing adipose tissue, whether it's subcutaneous or infiltrated into the muscle itself. And what I want everyone to do here, just in your own mind, is to try and rank these individuals in order from youngest to oldest in terms of their age range, keeping in mind what you presume their skeletal muscle health is going to show. So we don't have a poll or anything, and it's harder to interact over Zoom, but I would presume that most people are going to say the youngest individual is either A or B. And there's a progressive age increase with individual C, with individual D being the oldest individual. And presumably that's what I think most people are going to assume. But if we actually look at their age ranges, we can see that despite there's a 30-year age difference between these two individuals, individuals A and B, their muscle health or the quality and the quantity of those tissues is actually quite similar, I would argue, in that they're not really distinguishable based solely on their age. Whereas these 3 individuals, who may be similar in age, have quite stark differences in their muscle health, in which there's smaller muscles here. So this individuals experience atrophy and a lot of fatty degeneration into that muscle. And so what I want to kind of walk everyone through here today is what is muscle health? Why may this be occurring, and what can we perhaps do about it with exercise? So muscle health, really broadly, it can be just defined as the structural, the quality, the compositional, the functional capacity of your skeletal muscles to perform their actions, whatever they may be. And it's really a subcategory of your physical health and more broadly, your overall health status. As we'll come to see, it's perhaps quite an important contributor to your overall health status. And so we often define muscle health based on the tools we're using to assess it. In the lab, we can get really detailed evaluations of the structural or the compositional nature of your muscles. Like we can take, for example, like MRI images that I just showed previously, and we can begin to quantify the size and quality of those tissues, or perhaps through tissue sampling, such as a muscle biopsy, and you can directly quantify those structural components. And it's these baseline structural components that are really going to be important for the performance of that muscle. Whether, again, we assess performance in the lab using highly controlled and precise dynamometers to understand force generation and power generation capacity, or even in more recreational settings, such as a gym, in which we can evaluate the strength of that muscle. Now, ultimately, when we think about aging, though, perhaps most important is the functional status. How well can those muscles perform your activities of daily living? Are you perhaps still that 70-year-old triathlete that's able to freely move throughout the world and still compete at high level sporting performance? Or are you perhaps more mobility limited because of those perhaps impairments that are developing within that muscle? So as we move through this term of muscle health that I'll constantly refer back to, this is what I'm really referring to, some aspect of these various components. And I think it's an important parameter that is perhaps underappreciated. So Apologies for the busyness of this slide, but I think this is a really powerful message. This is a recent study from the UK Biobank in which they evaluated around 40,000 middle and older aged adults, and they followed them for 3 years. And we're looking at the risk of mortality. So across those 3 years, how often people passed. And they're looking at various variables and seeing how much risk is associated with that. So if we just highlight a few here, compared to those with normal muscle composition, so individuals with adverse muscle composition, which we're defining here as either low muscle volume, so they have experienced muscle atrophy, or they have a high degree of fatty infiltration into that muscle. So this is the combination of the two. There's actually a twofold higher hazard ratio compared to those with normal muscle composition. And this is for risk of mortality. So I think this is a rather powerful predictor of your overall health status. And just to kind of compare it with something that's perhaps more tangible to all of us, the risk of this hazard mortality ratio, it's on par to what people would have experienced if they had a previous cancer diagnosis or they're currently smoking. So two issues that we know have high risks of mortality. Our adverse muscle composition was as strong of a predictor of mortality as these two perhaps rather stark features. So it's really important, I think, feature of your overall health status. And it's quite a prevalent problem. So here's some work we did. It was quite a while ago in which we reviewed a various clinical populations. So these are just a review of various studies that have looked at either older adult populations or various clinical populations, various cancers and liver cirrhotic patients. And if you ask clinicians how they assess their muscle health or who may be at risk of poor muscle health, they will probably be able to point to maybe the use of body mass index. And so if we look at the proportion of individuals from these patient populations who are experiencing perhaps poor muscle health through the use of BMI, it probably only really represents the underweight patients, anywhere from 1 to 10% of the population. Whereas these individuals who are in the overweight or obese category, we don't really know what their muscle health is. And it's likely that your clinicians wouldn't consider you to be at risk of poor muscle health. But when these studies used highly precise laboratory grade measures to assess your muscle quantity in this case, the prevalence of what we call low or poor muscle health ranged anywhere from 40 to upwards of 70% of these patients, despite the fact their BMIs are in the obese or overweight category, as having low muscle health. And so it's a very prevalent factor that's being hidden by the fact we don't have proper tools to identify these individuals, and it's quite an important feature of their overall health. And so if we think about how our muscle health actually changes throughout the aging trajectory, historically, we've really considered this to be the model in which you're probably fine up until your late 40s, early 50s, after which there's this slow, gradual loss of muscle health, which may accelerate into older adulthood. But there is a lot of evidence has emerged in the past little while that it may not be this slow, gradual decline that is actually responsible for age-related decline. It may be these short stints of inactivity that induce these metabolic crises. So for example, maybe you have some sort of acute illness or injury like the flu and you're off your feet for a week or two because you're bedridden. We know this brief periods of inactivity can result in very rapid and significant deteriorations in both the muscle quantity, quality, strength, capacity. And when you tend to recover from that condition, we tend to see incomplete recovery or return to baseline from your muscle health. And so experiencing these repeated bouts of this inactivity through this injury or illness can accelerate you towards this sort of disability threshold. And so it's really critical that we have tools that we can apply prospectively to evaluate how muscle tissue may be all being deteriorated during these acute bouts. And so when we think about what are the ideal tools that we can use to identify these brief periods of muscle impairments, there's three things I always consider. How accurate is a tool? Is it consistent? And how accessible? Something that's often not thought much about. But if we start plotting some ideas here like body mass index, that's pretty reliable, really accessible, but as we saw, it's probably not that accurate in representing your muscle. Whereas we could get MRI scans, accurate, reliable, but it's probably not very accessible. And so if we think about the ideal modality, it probably lies somewhere in the middle. And I'm particularly interested in both the use of ultrasound because it can be prospectively applied at the point of care and there's no real issues associated with it, as well as grip strength. So I'm not going to talk much about grip strength, but this is the area we're focusing on currently in the lab more so. But I'll touch on some of the work we've done with ultrasound. So ultrasound is wonderful in that you can apply it at the point of care to capture these images of the underlying tissue. So here are two images of a young and older adult male, and we can begin to see different features of their muscle. So we can see the adipose tissue overlying the muscle, but we can also begin to look at specific muscles. So this is pictures of the quadriceps muscle. So you have the rectus femoris and the vastus intermedius. And using these images, we can begin to extract features such as the quantity of this tissue by measuring perhaps muscle thickness or the cross-sectional area of those tissues. And we can also assess the compositional, so the quality, how much fat has integrated into these tissues. So if you see in here in this young adult, most of the pixels within this young adult, they tend to be black or rather dark gray. Whereas in this older adult, a lot of the pixels are much brighter. They're a lot whiter and more intense shades of gray. And that is indicative of fatty degeneration into that tissue. So we can extract these features of muscle health using this very simple tool that's highly accessible in clinical settings. And so when we begin to look at how muscle health is different across the body of our younger and the open bars and the older adults and our closed bars, we're looking at muscle thickness here. We can see that it's not uniformly changing across the body. If we look at our biceps or our upper arm musculature, yeah, there's a small reduction in the size of that muscle across both males and females, but it's rather minimal in comparison to what we observe at specific muscle groups, such as the quadriceps or actually the rectus abdominis. So this is more of like that six-pack musculature. These muscles are particularly prone to age-related decline compared to other muscles. And so perhaps they're more important that we assess them relative to other muscles when we're trying to identify these individuals experiencing age-related impairments. And this is just for muscle thickness, but I could show you muscle composition or the fatty degeneration, and it shows the exact same display, but just for the sake of time, we won't continue. And so when we think of, again, how to identify poor muscle health, traditionally, we tend to use whole body metrics of muscle mass, such as DEXA scanners. But the issue is that we may be unable to detect this early change unless we begin to target those muscles that are experiencing earlier, more significant decline. So perhaps, again, those quadriceps or rectus abdominis muscles, we may be able to identify those individuals on this downward trajectory sooner, and perhaps we can then intervene earlier and perhaps mitigate some of these losses. And so this is sort of one area of research that I'm quite interested in, trying to develop tools that we can apply prospectively to identify these individuals. But subsequently, muscle health is declining with age. What can we actually do about it, right? We can identify them, but what can we do? And unfortunately, I don't know if there is a fountain of youth, but the closest that I can think of is perhaps exercise. And exercise is challenging to study, especially across the aging trajectory. And so often we've relied on the use of masters athletes as models of individuals who have been performing high level activity for long duration to assess the role of activity on individuals' muscle health. So keep this in the back of our minds. But I just want to introduce, before we get into masters athletes specifically, a unique feature of the neuromuscular system and how some of these age-related impairments might actually be occurring. So if we think about how our skeletal muscle systems are organized, critical for the activation of the muscle is the nervous system, right? There's the mutual interdependence between the nervous and muscle tissue to actually perform contractile activity. And so within the nervous system, so here's a cross-section of the spinal cord, there sits these spinal motor neurons. These are just nerve tissue that innervate the skeletal muscle fibers. And you're sort of born with a set number of motor neurons when you're young, healthy. And as with advancing age, though, due to either oxidative stress or some sort of inflammatory signaling, there could be loss of your motor neuron. So if this neuron dies, they cannot be regenerated, And many of those associated muscle fibers will also be lost with aging. And this contributes to the muscle weakness that we observe with advancing age. And so maintaining health of the nervous tissue in these motor neurons is fundamental to maintaining functional muscle health. And so if we look at how motor units or motor neurons change with aging, so here's just estimates of the number of motor neurons that individuals may have across multiple muscle groups. So the thenar, so this is kind of the fleshy part of the hand muscles, tibialis anterior and soleus being those lower leg muscles. We can see across young to old adults, we have this steady decline in the health or the number of our motor neurons. And again, maintaining a high level of motor neurons is critical for your muscle health because these individuals, this is the functional unit that actually is responsible for generating force. And so when we look into our masters athletes, so again, here's a nice work from Jeff Power, who's located at the University of Guelph. He's comparing young adults compared to older adults, and we see that expected decline in our number of viable motor neurons in that spinal cord. But he also recruited a group of masters athletes who've been performing high level activity and their age matched to our older adult control. And what you observe actually is that they are able to maintain their motor neuron number, presumably because they've been performing these high level physical activity events for the duration of their lifespan. And so these individuals, perhaps that 70-year-old triathlete I showed earlier, they've maintained their motor neuron health. And so they have equivalent motor neurons, and subsequently they've maintained their muscle health throughout their lifespan. So exercise may be that critical factor. And that's wonderful, right? Lifelong exercise is important or beneficial for maintaining our muscle health, but that's not the only way we can improve it, right? What about if we start now? Can you improve it even after you've lost a large number of your motor neurons? And the answer is yes. Here's some really wonderful work. It's a bit older now, but wonderful work from Bill Evans's lab in which they took a group of frail older adults over the age of 90. So they've experienced a lot of these motor neuron losses, and they had them undergo 8 weeks of resistance type exercises. And we can see at baseline, they had pretty weak knee extensor strength, but over that 8 weeks, every single one of these individuals improved in their muscle strength, upwards of around a 250% increase in their muscle strength overall. And these are individuals with a really degraded neuromuscular systems at baseline. And it also improved their overall muscle size. So we can improve both muscle strength and muscle size, even in those remaining motor neurons, to improve your muscle health overall. So I think this is a really powerful piece of evidence to really support the role of exercise in maintaining our muscle health. And so kind of wrapping everything up and just, when you're young and healthy, and I definitely didn't include 35 years of age because that's my age, in which I just keep pushing that boundary for whatever we consider a young adult. But when you're young, and it may not really matter whether you're exercising or not to maintain health, but throughout the aging lifespan, when you start reaching into older adulthood, those who've been maintaining their exercise throughout their lifespan, they are going to be able to maintain their muscle health to a higher degree compared to those who have been perhaps more sedentary. But there's always that caveat that with exercise training, even later in life, you may be able to result in that improvement in your muscle health overall. So I think that is kind of my take-home message, being it's never too late to start training in terms of resistance and various forms of physical activity to try and mitigate or actually improve some of those age-related impairments in muscle health. So with that, just a quick thank you to everyone for attending, as well as our current lab and past lab and all of our funding sources. Thank you.
Thank you so much, Michael, for this very interesting conversation. You've inspired me to start.
Sharing?
Oh, yeah, you can stop sharing your screen right now.
Sorry.
Yeah,
Thank you.
for sure. Thank you so much for that. It was so interesting, and I am inspired to start to exercise more. As you said, on the younger side, but it's still great to do. So thank you for To everyone in the audience, we want to give you the opportunity now. Many of you have already started asking questions, but we'd like to give you the chance now to also submit some questions. So feel free to submit in the Q&A function, and we will start a bit of a Q&A right now. So we're going to start with our very first question that came in nice and early. Are there opportunities for older adults to participate in any of these studies or other activities of your lab, particularly older adults who still exercise frequently?
Absolutely. Our lab here at York is fairly new. We only started a few years ago, and and we have a few key studies that I'm hoping to actually initiate in the very short term that are trying to answer some of these exact questions. We've actually more moved towards this idea of grip strength as a global marker of muscle health. Is a marker of neuromuscular function. It's really commonly used in the clinical settings because it is easy to apply and obtain these measures, far easier than even perhaps ultrasound imaging. But we really have a poor understanding of the neuromuscular determinants of grip strength. And so a lot of the work we're starting to do in our lab is developing models to better begin to integrate central and peripheral neuromuscular function to understand how the nervous system and the muscle systems are changing with age and why grip strength is such a powerful marker of someone's health status. So yeah, absolutely. There's lots of these opportunities that are emerging. What I've been touching on is the last half of this presentation, more about the exercise related remodeling. Future work, absolutely. In our lab, we're starting small, and that's the end goal. But there are certainly other studies that are currently running that are always looking for older adult participants, particularly those who may be still participating in exercise or maybe more sedentary. So please
Good.
reach out to me. Yeah, I'm sure I can send my email at some point, but if you
Yeah,
are interested in those things, please reach out.
we can share your email towards the end. If you're
Oh,
okay
thank
with
you.
that, we'll put it into
Yeah,
the
yeah, for sure.
And that kind of falls in line with the next person who said it's going to be interesting to see if the pandemic affected a lot of us when we stayed home and started to work from home, when we became far less active for months and years, if we're going to be able to get back on track. And so I think you already maybe answered this toward the end, but are we able to recover, lost muscle quality? I'll let you kind of just reaffirm that.
Yeah, absolutely. A lot of that, when I was talking about those earlier and rapid declines in muscle health that we tend to see with short-term disuse, weeks, months perhaps, a lot of that degradation occurs at the level of the muscle. Your motor neurons themselves definitely will contribute to that weakness that's observed, but the actual loss and because the big issue is when you start losing your motor neurons and those motor units become lost, you can't regenerate them, sort of thing. That takes decades of remodeling for that to occur. So that's a bit of a slower process. So it absolutely can occur on the span of years, but it's not something that's going to be, you come off your feet for a week. You're probably not losing motor neurons. That's going to take decades of time to actually have enough damage to occur to actually lose those. The initial atrophy and impairments in muscle health that are occurring, those are certainly recoverable. That incomplete recovery that I kept referencing early on with strong physical rehabilitation, you can absolutely recover back to your baseline. It's unfortunate though that what takes a week to lose in terms of your muscle health, muscle size, muscle strength, it would probably take 3 or 4 months of activity to recover. So it's you can lose things really quickly, and it takes a long time to recover, especially as you get a little older, right? Those recovery processes are perhaps less efficient.
Wow. The next question, have you done any research about exercise that is mainly limited to activities like using a QB or using a treadmill or engaging in rhythmic exercises while listening to dance YouTube sessions? Have you done any research like that?
I have not personally been involved in any of those types of research. I'm unfamiliar with the QB, so if you wanted to clarify or over email, happy to chat more about that. But there is quite a bit of research out there on various interventions that are more tailored towards lifestyle interventions, not just going into the gym and lifting weights, because I know that is not for everyone. It's probably the most effective tools we have in terms of like resistance types exercise, in terms of maintaining at least contractile strength and muscle size and quality. But there are absolutely many other interventions that can be incorporated, like dancing or Tai Chi, I know is a very common one, yoga interventions that all have benefits in not just muscle health, but various aspects of mental health and various other physiological systems across the body. I'm not involved in that research personally, but I know there is a lot of interest in those more holistic approaches to maintaining your health status with exercise and activity.
Great. Our next question, and I want you to know they are coming in fast and furious. Um, can exercise generate new motor neurons, or does it just slow down the loss of functionality?
Yeah. In human literature, at least in human research, from my understanding, the set number, you're born with a set number of motor neurons, and we are just trying to limit the loss of those motor neurons. So cellular damage accumulates over time, and we lose those motor neurons. So we're trying to sort of limit the decline of them. And when you lose and again, another factor we never really got into, just for the sake of time, when you lose that motor neuron, not all of those muscle fibers are lost. Some of your existing motor neurons can sprout to save your muscle fibers. And that is, again, exercising helps maintain that process. But it is a finite process. And eventually you lose sufficient number of motor neurons that you can no longer maintain this sort of not regenerative, I should say, but this reinnervation process will eventually become limited, and you may eventually start losing muscle fibers at a quicker rate. And that's probably responsible for that accelerated decline into very old age.
Okay. Another question. So for the slide where you noted that it's not too late to start exercising in that 8-week trial, what was the frequency and duration of this resistance training?
I'd have to go back and dive into details into their methods, but I think it was around 3 or 4 times a week with probably fairly high intensity resistance loads. Historically, we have really thought that in order to improve your muscle health, it required the use of high loading parameters. It's more about how the muscle activates, and the only portions of your muscle activate at low intensities, and it requires higher intensity contractions to activate these, to fully activate the muscle, let's say. But there's been a renaissance in that thinking as of late, in which there's lots of evidence now emerging to show that low load resistance types exercise can be just as beneficial, if not actually more beneficial, depending on the parameter, in terms of improving the quantity and quality of the muscle. When you talk about muscle strength in terms of the actual amount of force the muscle can generate, there seems to be not a necessary requirement, but it's certainly perhaps more beneficial to occasionally practice lifting heavier weights, because there's a lot of neural adaptations that are very specific to the types of, it's kind of like you want to play as you practice as you want to play. If you want to get strong, you need to kind of practice performing these movements with these heavier loads. But there's still absolutely benefits from doing these more low load types of exercises, less risk for strain and injuries, especially as you perhaps get older. But my advice is always to sort of seek out help from various professionals, like various exercise physiologists that are accredited with various bodies, to sort of to learn those different movement patterns, because there is always risks of injuries, especially for those who are just starting
in. Can you give examples of specific exercises that would be appropriate if you are starting out or continuing?
Yeah, I think this where it comes down to that point I just mentioned. Speak with your healthcare providers. There are lots of certified exercise physiologists that have been accredited through various governing bodies, like the Canadian Society for Exercise Physiology is one just example. These individuals have been certified with prescribing and monitoring exercise performance, especially for those that are just starting out. You don't need to necessarily go to the gym, because the types and recommendations I would perhaps give are going to be individualized based on your current starting progress. It may be as simple as standing up from a chair, repeatedly standing up from a chair may be sufficient for the starting point for some individuals, whereas other individuals who perhaps have higher muscle health at baseline could start in more perhaps advanced type movement. So it's really hard to give general advice. My advice is always to reach out to your family physician, make sure that there's not any underlying issues that are preventing you from perhaps initiating these exercise programs, and then from there reach out to certified exercise physiologists to really help you initiate some of these movements to get that sort of baseline level in which you can then go on from your own.
Next question is, what is meant by muscle group?
Muscle group.
Yeah, I guess a definition is what they're looking for.
I guess that might be referencing when we start talking about how your muscles are, like which muscles may be more affected across the aging trajectory. So, I mean, it's a great question, and I think it depends on the movements you're trying to understand. So, we broadly group muscles together into functional units. For example, when you try and kick your knee out or extend your knee, that is the quadriceps muscles that are the primary mover of that action. And there are 4 of those quadriceps muscles, right? The 3 vasti muscles, the vastus intermedius, medialis, and lateralis, and then the rectus femoris. So there's 4 muscles that we group together because they're functionally similar in that they all extend the knee. So that's typically how I would reference muscle groups, made up of functionally relevant muscles that are contributing to similar actions.
Great. I might have to bounce around with some of the questions now, so to make them a little different, but the next one is, you have referenced masters athletes. Are there studies about the impact of moderate, regular exercise in older adults? And also, how effective is walking as opposed to core strengthening exercises?
Absolutely. There has been a plethora of literature that has looked at varying intensities of both aerobic, which I didn't really touch much on in terms of like aerobic exercise, but it's just as important for, yes, muscle health, but also cardiovascular, various physiological systems health. And there has been a lot of evidence to support across the intensity spectrum, from walking to moderate exercise to high intensity exercise. If you look at the guidelines, for like, there's a Canadian Physical Activity Guidelines, they have various suggestions in terms of reaching sufficient amounts of resistance types exercises as well as more aerobic type exercise. And there's various timelines, like if you exercise at higher intensities, you may get benefits at shorter durations compared to perhaps walking, which you may get similar improvements in cardiovascular health or muscle health, but it may take longer duration. So I think varying your, the variety is the spice of life. Varying your exercise modalities is probably the most important for maintaining your muscle health overall, both resistance types exercises, but also aerobic exercises across the contraction intensity spectrum. There's evidence for all of them. Whether one is superior over the other, it comes down to like the population, what you're trying to improve the most, but certainly evidence for all of those. And I would encourage you to just look up the Canadian Physical Activity Guidelines, where they begin to parse out these different modes of exercise as well as the relative intensities and durations they should be performed.
That's great. And there are multiple questions where people have asked kind of the same thing. I was just kind of grouping them together. Like what types of exercise and so I guess you've answered that well there. I liked this one. Kids are very sedentary these days. How do you see this affecting, I mean, they're young right now, but how do you see this affecting them in their adult life when they're not so young?
Yeah, that's a great question. Um, a lot and again, this is not my area with children physical activity, but there is a couple fantastic researchers here in the kinesiology department that study this exact question in terms of like motor competency and how important it is for children of these young age to engage in physical activity to develop these motor patterns that are going to be critical for their lively for their life moving forward. And there may be these critical periods that may be necessary to teach, or you can at least learn these motor patterns easier than other periods of childhood. So absolutely maintaining child health through physical activity, not so much structured physical activity like we tend to do as adults, in which we go to the
Mhm.
gym and we sit on treadmills all the time. It's unfortunate because it's quite boring, but more spontaneous physical activities such as play is absolutely fundamental, and it likely contributes longer term to many of the health complications that were that's emerging within the developed world, that um, this reduced activity or in early childhood would contribute both to lifestyle factors, that people would probably be less active as they age, but also maybe some more health related parameters that are important early to develop. But can't say too much on that because it's not my
Mhm.
area.
This was an interesting twist, kind of a new question. So many older adults suffer from arthritis in their
Mhm.
hands, and the question is, would this not affect grip strength, even if they are otherwise in good muscular shape?
Absolutely. Muscle pain, or not muscle pain, any pain when you're performing these activities, it has inhibitory signals sent from the periphery where those pain receptors are back to your spinal cord and to your brain, and it limits your motor output. And so when we talk about perhaps grip strength as a tool to identify individuals with poor neuromuscular function, there are absolutely limitations. And that is an excellent example of one in which we're trying to assess the functional status of your overall neuromuscular health, but you may be limited in some capacity, that it's not a true representation of the health status of your neuromuscular system. So broadly, these are wonderful tools, but on an individual level, there may be limitations. And in those instances, perhaps measures of function that are not limited to voluntary contractions may be more relevant, like ultrasound or MRI, in which we can quantify the size, the quality, the structural composition of that muscle tissue as an indicator of the overall health status. Like ultimately, the size and quality of the muscle, they're important, but they're ultimately important for the function of muscle, being its contractile output. If you can't assess the contractile output for various reasons, we can use imaging methods as perhaps surrogates of that functional capacity.
Again, I'm trying to find unique questions. So this one, somebody has mentioned first great presentation, and
No,
their
thank you.
question is, can you speak to muscle health impact on bone health?
Very interesting question. Yeah, absolutely. So again, I don't do a lot of bone research work, but there is, for those interested. Again, I'll just kind of shout out our colleagues here. There's a researcher here, Andrea Joss, who studies immune function and bone health and sort of the role of dairy for improving bone function and health. So, um, if you're interested, I would absolutely encourage you to reach out to her because she's wonderful with that sort of thing. But we know with bone mass, and this is just mass, there's lots of structural components that are not necessarily evaluated, but we tend to observe peak bone mass, bone mineral density somewhere around your mid 30s. after which there's this slow, steady decline in your bone mineral content due to hormonal changes, a whole bunch of factors. Muscle health is critical for, it's critical for physical activity. And we know with bone health, resistance types exercise, high impact movements, the muscles physically contracting and pulling on the bone, all of those are critical signals for the bone to remodel in order to maintain bone health. And so by maintaining your muscle health, you can perform those activities of daily living, you can perform your exercises. That is fundamental for maintaining your bone health. So you reach your peak, let's say your early 30s, late 20s, after which there's a slow, gradual decline. You're trying to mitigate that decline by maintaining health status of the system and maintaining your physical activity to try and maintain your bone health as high as it possibly can. Maybe there's ways to actually augment it, perhaps with certain drugs and exercise, but that's always been my understanding. But again, Andrew will have much better insight into that specific question.
Great. And I'll just let the audience know that we have put Michael's email address in the chat, as well as the link to his lab that he has mentioned, because some of you have asked about how to get involved or be part of studies. And then again, you can also ask him about the colleague that he has just referenced as well. And the questions have been amazing. We're going to go with one final question because I think otherwise we will go very, very over time. But I think this is an interesting question. Somebody asked what happens after hip replacement, because obviously that would affect your exercise and everything you've spoken to towards muscles. So I'll give you the opportunity to speak to that, the impact of that.
It's a fairly large surgical intervention that's going to really limit your mobility for a relatively short period of time following the surgery, but hopefully in the longer term, it allows you to live more pain-free and actually engage in more regular physical activity. So with that acute injury or illness model that I presented before, following that surgical intervention, you're going to have higher systemic inflammatory response. You'll probably be relatively inactive because of your recovery period. And you'll probably have an acute bout of decline in your muscle health, right? Atrophy, muscle weakness that you'd experience very acutely. But following that, if that surgery allows you to then engage in regular activity and perhaps start doing this functional rehabilitation, it can overall perhaps lead to higher muscle health in the long term. And perhaps perhaps trying to get to the higher level prior to the surgery, doing more of a prehab is a rather good idea to try and get it to a high level so that your decline is less and it allows you to be more functionally mobile earlier to maintain to try and get back to sort of rehabilitative approaches earlier than you would have otherwise.
Well, I think that's an excellent way to end. And Michael, thank you so much for being with us. You have had a very engaging talk. It looks like everybody really loved your presentation. The Q&As, I think, were the highest number we've seen in a very long time. So
perfect.
thank you so much for being with us. And again, to the audience, we've shared more information. If you want to keep in touch with Michael or learn more or visit the lab website, it's in there. So thank you so much once again, and feel free to turn off your video.
Okay, thank you. Take care, everyone.
Take care. And just for the audience, a recording of this video is posted on our YouTube channel in a few days from now, and we will put the link in the chat. We do have one more question for the audience. How would you rate your knowledge of today's topic following the discussion now? Join us also on November 26th for the last captivating session of Scholars Hub of 2025, The Quest for a Great Place to Work, featuring Anirban Kaur, Assistant Professor at the School of Administrative Studies at the Faculty of Liberal Arts and Professional Studies at York. Scholars Hub will be back in January with more exciting and engaging discussions specifically designed with your interests in mind. We look forward to seeing you at the next Scholars Hub session. Thank you and be well.